So you're tired of dealing with chronic pain? Well, let me tell you what we can do to make that better. So here are some common medications that we use. Now let's break them down into first line, second line, and third line. Now when we look at the first line therapies, there's three things on the first line that can make a really big difference. The first batch of them are anti-seizure meds. Think Gabapentin. Now Gabapentin is good to use, but it can cause some dizziness and sedation, so we make sure that we start at low doses and we increase slowly. The second one you can think about in the first line are antidepressants such as duloxetine or venlafaxine. They help with pain and depression. Now it usually takes a few weeks for them to show their full effects. The third agent that we'll sometimes use as first line therapy are called tricyclic antidepressants. Think amitriptyline, nortriptyline. These can help, but we start really slow to avoid the side effects with these, which can be sedation. Now, second line therapies we usually use when the first line aren't working. So think of something like capsaicin patch, around 8% or so. We usually apply that to the painful area just for a short amount of time because the long-term safety data isn't there, so it's only a short amount of time. Another patch, lidocaine patches, can also help apply to the skin for temporary relief. The last particular medication to think about is tramadol. Tramadol has mild opioid-like painkiller effects, but once again, this is for severe pain and isn't used that long. Third line is Botox. Botox is something that's been shown in studies to be helpful if injected in the painful areas, but this is usually done by one of the specialists. And last but not least, opioids. Opioids are always the last resort, but if needed between you and your doctor, you want to start at the lowest dose and be very careful to avoid any of the risks. So remember this, pain management is very personal, and you want to make sure that you're finding the right balance with your doctor to make sure that you both are partners.